Hello and welcome to the Symposium on Healthcare Value Analysis and Infection Prevention. I'm Kelly Pyrek, editor and publisher of Healthcare Hygiene magazine. I invite you to explore with us the key issues that these two disciplines can address in a challenging healthcare landscape. We've gathered thought leaders from across the country to share their expertise with you, and we hope you'll find the sessions to be a springboard for further dialogue at your institution. No important undertaking like this symposium is conducted alone. We appreciate our incredible speakers for their hard work in preparing their presentations. We also thank our partners in this endeavor, the Association for Healthcare Value Analysis Professionals, AVAP, the Pierce Foundation for Scientific Endeavor, and the Environmental Services Optimization Playbook, ESOP. We also acknowledge generous underwriting from Cintas Corporation, which made this program possible. As a reminder, this symposium will be available on demand for 90 days in case you miss any portion of the program. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. Thank you for your participation, and please stay tuned for more symposia to come this year.
Good day, and thank you for joining us today as we discuss value analysis for infection control in the COVID-19 era. My name is Beverly Nieves. I am the Corporate Manager for Infection Prevention and Control, and joining me today will be Mr. Mike Parker, the Director of Environmental and Linen Services. Today, I would like to discuss with you key considerations for product evaluation, describe the collaboration between infection prevention and environmental services in product selection, discuss the importance of being able to make a business case for evaluation of safe and effective products to improve environmental safety, describe a new environmental services approach to value analysis, and discuss team member involvement. In 2020, we had a new challenge. We have a new pathogen called SARS-CoV-2. We namely called it COVID-19. In January of 2020, the first laboratory confirmed case was identified in Washington. By March of 2020, CDC reported an outbreak, later pronounced it a pandemic. At the time, there was limited knowledge about this new virus regarding transmission. We later learned the virus that causes COVID-19 is spread by respiratory droplets generated when people with COVID-19 infection coughed or sneezed. The droplets can lead to infection in people who are in close contact. And the droplets can also contaminate surfaces where it can be transmitted. We also had limited information on how long the virus is able to survive in the environment and how it could be destroyed. The COVID-19 virus, we later learned, can live for several days on some surfaces, such as stainless steel and plastic, most of the surfaces that we have in our hospitals. Under certain conditions such as sunlight, humidity, and temperatures, can either shorten or lengthen the time the virus is able to survive in the environment. What we did learn was that this virus was susceptible to many chemical disinfectants that we currently have in our arsenal, such as bleach and hydrogen peroxide. So it brought a new challenge and a new opportunity for us to select products that were effective in cleaning and disinfection. We needed products that had evidence-based results, that were safe for our patients, safe to use, compatible with the current equipment that we have, that did not require unnecessary disposal requirements that could be costly, that was able to survive in the shelf for whatever period of time we needed it, and that we could follow the manufacturer's instructions for use. This was the beginning of several conversations to assess the effectiveness of new cleaning products and technology. It requires swift process to assess these products due to market demands. As you were aware, we started having some shortage because just not only were the private entities garnishing a lot of these products, but also all the hospitals went on to hoard these products as well. So infection prevention partnered with supply chain and EVS to ensure accessibility to these products, that our vendors have sufficient supplies, and they need to forge new relationships with new vendors to ensure sustainable resourcing. When we evaluate these products or technology, they need to be safe, again, for our patients and staff alike. And what we wanted also was products that were not damaging to the environment. So I know we have a goal of going into a green, cleaning environment, but still needed to be able to kill the virus as well. So incorporating this new requirement in selecting our products into a plan, it created an opportunity for us to create an ad hoc value analysis team. Information was rapidly changing, as you may recall. Resources were limited. The information that we were getting changed every single day, depending on the sources you were looking. So during this time, infection control, along with EVS, forged deeper connection because we really relied on one another to keep our ears open, contact our other colleagues at different facilities to see what they were using, and get new leads on new products. We partner with the education department to create education materials that were simple and easy to follow. We really relied on everybody to become an educator at that time. All the leaders, we had to become educators and be out there on the floors to ensure that our staff was comfortable with new products, and that it would really lend itself to for them to adapt to the changes more readily. I believe that one takeaway I have from this opportunity, from this experience, is really that the staff really saw you as their source of information when they saw you on the floors. It made them feel more comfortable about the products that we were asking them to use, even though they were new, that there was no formal training. That I would approach them with my education sheet and say, okay, so remember that product that you used before that was 3 minutes? Well, we have now one that's 2 minutes, but you have to make sure that is the right one. And because the cleaning was occurring not only by our EVS partners, but also our clinical partners as well. So it was very important for us to ensure that they be part of that selection to a degree, so they feel more comfortable and more at ease with those products as well. So incorporating all these changes and all these cleaning protocols into a plan is become now a requirement, right? So how did this affect environmental services? As we continue to change of our protocols, again, we needed to have that close relationship, so they felt comfortable that this is the way to go. We have improved relationship with our vendors. We ensure that our vendors knew that we value their support. It also opened the channels for new relationship with other vendors and manufacturers. Involvement with the emergency plan and how we can, it was a living document. We needed to constantly be assessing and continue to understand what was working and not working. Every time there was a shortage, we relied on our vendors to say, okay, you may only have a 30-day supply of product X. So we needed to, again, work with our supply chain to ensure that they had other leads on the same product or similar products. we identify as, mixing chemicals was not the best route to go for our organization. So we rely on our safety department to ensure that we follow the SDS sheets of the new products to ensure that there was no harm to our staff using those products. We again had new education protocols and training, and also ensure that we had increased monitoring of the use of these new products in our house and our hospital. All of those things made it for it to be an ever-evolving process with its challenges, but also its rewards. It identified and opened the door for innovative ways of doing things, identify that, um, we can adapt to the market challenges for new products. We can adapt to new protocols as long as there is a general consensus, and those decisions are made with understanding of this various stakeholders. So it's not just infection control working in a vacuum with supply chain, but also involving the end users, such as environmental services. And during COVID, right, we relied on the clinical staff to do some of the cleaning as well.
Good day. My name is Mike Parker, and I want to stay here for a moment. Beverly brought some great points up. And in my 30 plus years of being in environmental services, I think I've been through a lot of disasters, been through a lot of issues, but this is the first time, and probably only in my lifetime, where we've been through a pandemic. And I really want to touch base on it because I think this changed the way that we operate forever. I don't think we'll ever go back to normal as it relates to our protocols, how we purchase, how we look at things, and how we behave. And so I really want to talk about, our vendors. They were great, but now they have the next best thing to sell. So we spend a lot of time with them bombarding our doors now with the next great thing that they have because of the pandemic, or they used it in the pandemic. So I think your directors and not only your sales, but your directors, we're going to see a lot more people knocking at your door with different things and new technology. I think technology will become a very big focal point. So I just wanted to kind of touch with there. I also want to say, as we look at this, our involvement in emergency planning from an EVS perspective, I don't think we had a strong seat at the table, but I believe this catapulted us to where we have a seat on the table. So I'm hoping that great things come from this, and that people learned a lot. I think it changed some lives. I want to just, this handling shortages was interesting. We had dry wipes and we poured chemical into the dry wipes. It wasn't mixing chemicals, but it was really making our own wipes so we can move faster. Interesting story. I actually moved states in the middle of the pandemic. So I remember both sides of it, coming from the north to the south, both trauma hospitals, but how we were impacted as a whole really changed my perspective on the business. We look at everything that we do, we forget about the things that we do that we practice once a year or twice a year, and then they come and hit us, and it can change things. And so I look at the incident command operations. We popped it up, and I remember days of being up 24 hours a day, taking call or meeting about the CDC just changed something this minute ago, and it changed 3 minutes later. And then, oh, by the way, our vendor doesn't have any more of the product, and how we had to, as a team, switch tracks, switch gears at a quick rate and get it out to keep the team safe. So I think it was very collaborative, and it taught us that we can do it together. And everybody, it was a village approach. The education and training that was provided on the go with our team members, whether it be a nurse, a respiratory therapist, or environmental services technician, we really had to push it. And may not have been our comfort zone, but we knew we did the best we could do and made the best decisions for our patients and our team members to keep everybody safe. And so, I remember Beverly and I have talking several times about how we got through things and how we needed to talk. I think I have Beverly on my phone a whole lot because we talked a lot during this process, and it really made me really appreciate the relationship between environmental services and infection control, because I think we just thought we got along well. We understood each other's jobs. We understood the mission, but now we respected each other and counted on each other through this all. And I think that made it a lot better. So I just want to touch base with a couple things because this particular issue hits home with me, and I'll kind of talk about it as we go through, but I think it can hit home, and it hit home with my team. So the reason I came to talk to you guys today, I just want to talk a little bit about and pose something to you. And it's really, we've been doing value analysis, and we really go through the value-based, and we do the safety, and we check this box and we check this box. But I really want to talk to you about, what if you really looked at it from a different perspective and really looked at it and about, let's incorporate value analysis into our daily operation. Let's make it a part of our customer experience. Let's incorporate ingrain it into our training. Our team member morale. What do we look like if we really believed and acted accordingly with zero harm? What does that look like? And then how do we incorporate it into our mission and push it into our service line and right in line with our strategic imperatives of our organizations? What would it look like if you gave end users the ability to give input, to empower them to make decisions, and empower them to work with the team? How would it look? And a lot of times we all check the boxes and we do this and we do this. But what if we took the time to think about it differently to get the same result or a better result? I look back over this time, we had environmental services in the middle of this pandemic, and they were scared. They were being affected. They were making decisive decisions. They were terrified because none of us had ever seen it. They're worried about their kids and their family members at home. They're worried about, my loved one might pass away from this. My kids may pass away. I'm scared to work around this because I don't know what's going to happen. So it took us time to pause. I remember, we had team members, whose husbands have passed, wives have passed, kids, aunties, uncles. This went on for a length of time, and you could see the fear in people's eye. But we had a group of people who really had a desire to continue to serve. And so we thought about, we do these things for them every day, and we call ourselves helping. Let's incorporate them into them and really incorporate into what we do to make it better. And so we took some simple things, and I want to share them with you today because I think they were powerful. I think they were inclusive. I believe it changed the department, and I don't want to make small of the value analysis process because I think it has its place. I think it's a valuable tool, but I'm going to ask you to add a little spin on it or add something to it. And I think you'll get a better result. It's kind of like putting whipped cream on a sundae. So that's what I want to pose to you today. So kind of just in general, our stuff is just basic. It's not a special recipe. You're not going to have an aha moment, but you're going to say, they just return to basics. So I wanted to share it with you. Our guiding principle is our mission statement and our philosophy of our department. And it's simple: provide a clean, safe, healing environment for our patients, visitors, and team members. That's it. And that means the world of people, and all of the team can recite it, but they also know what it means. And everybody is taking it on personally. So we started with that. Let's get our mission together. And then once we got our mission together, we said we have some strategic initiatives that the organization has for us, and we're going to make sure that we're in line. We can't walk to a different beat, but we can own the strategic initiative. So what does it mean to environmental services? So we took our first strategic imperative, which is embracing quality and safety. And we basically said, you know what? We're going to have zero harm. We want every team member to go home the way they came in, but not hurt. We're not going to buy products that are against what we believe. So what would that mean? We're going to be zero harm. We're not going to buy corded vacuums. We're not going to buy corded machines. We're going to try to do it a different way. We're going to provide quality outcomes. We're going to measure what we do and be science-based and data-driven. So, can we produce this or replicate this? So that's kind of where we're at with it. Earning physicians' loyalty, I'm going to say this one was a little difficult, but we had it in the back of our head, and it was just, we have to be at the table at all levels. And when we're called upon, we have to be trusted advisors. So we study up on what we do, and we all sing from the same song book. So if the doctors ask or the physicians ask something, we could all sing it from whether you're the director of the department or the housekeeper. We all spoke the same language. Number two, we did our jobs. We were scared like everybody else, but they counted on us to be there each day, and we were there. So that's our physician loyalty. And they became loyal to us because we set an expectation, or we set the groundwork for that. And I think they went over it 100-fold. So, we have doctors high-fiving the team now. So it really is working. As you may or may not know, we strive to be the best place to work. And so we want team member engagement. And it's past just saying it. We preach to our team that you are part owner in this department. So what would the owner do? Whether it's, we're going to spend our money wise, we're going to be what we say we're going to be. And that's everybody being accountable to each other. That's everybody acting that way. And it's really, we started with a different look. We started with different expectations. And so people began to buy into it and really focus on it. And it's getting some dividends. When you have to give your input on something and you have to be able to tell a patient about something, it's powerful when it comes from an EVS person. Because most people think that's just a person who cleans my room. No, we're professional. We're professional, and you're at the heart of everything we do. So if you want to know something about the hospital, I have many stories where patients are scared and they talk to the EVS person and they calm them down and then go back and visit them. So people begin to become owners. And so they're the voice of the patient as well as their family members that they protect and that they come visit and see. And we all families get treated here. So we all have to be owners of this. Strengthen our economics. That's one that we believe if we do all the other things right, we'll gain market share. And as long as we don't spend money crazily, uh, we will gain market share and gain world-class status. So, what does a place look like? And this is what I tell my team all the time. What do we look like? Nursing has great outcomes. The physicians has great outcomes. Why can't or why shouldn't we have great outcomes for environmental services? And so people really have bought into it. So we believe if we do all the things right, things will be right and things will get better. But we also know that we got to do the right things as well. But we believe the driving force is doing the right thing. And lastly, serve our customers well. This goes into a plethora of things. But I would say mainly is each and every one of us have a family member, a spouse or a mate that uses our hospital. So we want to give everybody the same treatment we would give one of them. We want to advocate for them. We want to advocate for them on a regular basis. So if there's something out there better, let's talk about it. Let's suggest it, because it's just like we're taking care of mama. It's just like we're taking care of one of our grandchildren or nieces or nephew. So we advocate constantly for better products. Our thing is we want to provide world class for our patients, and not only just our patients, but our team members. So we want, what does world class look like? It's a journey. So we advocate daily, we work at it daily, we strive to serve, and that's where we are in our journey. That's where we are in our belief. And so if you tie our mission and our strategic initiatives together, that starts our journey. And that's pretty much a great world map, in my opinion. And if you listen to Beverly a little bit earlier talk about, the key things that we do, how we had to transition. I don't think we're different from any other hospital USA. But what has happened is, I think we've gotten some niches and we've gotten some things in order, and the relationship is there that we can put that sprinkle of whipped cream or candies on top of the soda and really take it somewhere different. So I really believe that in my heart. I believe that every day I get up to come work with the team, work with the infection control team. I think we have something that I think it's taken us where we need to go. So, we don't forget some of the basic things. We have to be accountable to each other. We have to be accountable to our teams. We have to be accountable to our strategic initiatives as leaders. But what we do is we follow the basic principles and the fundamentals. Yes, we have to have a value analysis team. We have to go through the process. We have to look at our costs. We have to look at our product and our value on that product, and what do we need now or for the future. But we also have to do some basic things. And so, Beverly has brought us into what we do, what we did during the pandemic. We have kind of talked through some things that we've had. I want to talk to you about some additional accountability and how we drive it down and up. And so if we can indulge me for a minute, it's really, we have a team. So inside the environmental services team, we have a few groups, and I'll start from the bottom up, if you don't mind. And they're our foundation. That's where at the bottom. Doesn't mean at the bottom, but that's our foundation. And it's our team member council. It's a council that's full of team members. There's no leaders of any sort on the team. And they talk, look at, and assist in accountability factor number one, which is to each other. So the team members actually talk about morale, things they would like to see, training, how is training going, what they would like to see, what do we need to do differently, patient issues. It's just a place to have a voice. and they're those same people that go back out to the other team members and talk about it. And they're the spokespeople for the team. We have representation of all shifts and all skill sets. So I think it's a great, solid program. And we kind of got looked at it first. We're owners. We got to sit down and have some trustee meetings. And so we started it. And I think it's given great feedback and great benefits. We have our recruitment and retention team, and all of them are different for a reason. We really have our recruitment. Let's go out there. What are we doing to get people? And then once we get them, what are we doing to retain them? Because, you can invite people in every day, but how fast are they leaving out the door? And we watch that and we monitor that and we do things to make sure that we're constantly looking at it. So this team also, and all three teams communicate back and forth and share ideas, and ad hocs are created out of it. So, but the main thing is that we're all accountable to the advisory council, which is our operations team and seats from everybody. So I chair this committee, but I don't run this committee, if that makes sense. It's really people working around the table to get help, to give help, get help, hold people accountable. We talk through to make sure we are what we say we're going to be. And we look at it on a regular basis. And so all these committees actually report up to this committee or council, and we really talk about things on a regular basis. And we spend time in it. Our team member council meets weekly. Our recruitment council meets every other week. Our advisory council meets every other week. So we're investing the time and really making this a good process. So wanted to share that. And we thought through all this in the midst of COVID, because everybody was scared. Nobody knew what to do. And when you're at the time, you don't push away from people, you pull people together. So we said, let's do it differently. We had record numbers of people walking out the door because they didn't want to do it anymore. So we had to do something different and think differently. So the value analysis process, I believe, put everybody in the midst of it and gave ownership, because you get to decide what we're using and you get to explain what we're using. And you get a comfort level from that, and these people are out in the community. So we started at the right time, I believe, and it was a right time morally, not just the right time to feel good. Then I want to kind of bring it in. Beverly talked earlier about some of the processes that we use and thought process that we use through value analysis. We talked about the evidence base. We talked about the shelf life, to kill time. We talked about cost, but really this is the other side of that. So I think I spoke a little bit about vendors running at your door, now trying to sell the next best thing. And so we talk about it and we laugh some days about it even. But we have to get to a point where we can't have a bunch of samples of everything. We have a responsibility to supply chain. So we kind of look a twist on it. So our form isn't pretty, but it's very effective. So basically what we do is we, if we want to take a product to the VAC team, what we do is we kind of check the boxes off. And so to get on the Christmas list, you got to at least do some things. One, you have to get 2 out of the 3 boxes checked. I mean, does this product address our quality or safety initiatives? That's what we want to know. And it's a yes or no. It's not a maybe or sometimes yes or no. Does this product help serve our patients well? The other one is it going to help us or assist us to get to on our journey to world class? If it's not, we're done. And then if we get through the beginning part of it, then we start checking, is it an approved vendor? Because we don't want to be out, we want to be compliant with supply chain and whatever GPO you're with and different things like that. And then we have the advisory board, have they approved it? Then we have infection prevention. Have they approved it? Are they on board with it? Those all have to be checked, and we stop right there. Now, most of the time, we get invited to partake in presentations or samples from different vendors. This kind of shuts it down, or really gets us behind it from day one. So before we do the scientific recommendations by CDC or what supply chains has in VAT, we actually just do some basic things. And these are it. Does it contribute any value? What's the value? We want to know what the value proposition, and this value is not money. It's really, is it going to make safety better? Is it going to make our staff more comfortable? Is it easy to train? We talk about different things like that. We look at it different ways. Do we need all these features? Do we need the bells and whistles of this product? Sometimes we want things, but really don't need them, and it's shiny. We want to make sure we pretty much put it in perspective, that everybody's on the same page. And I'll touch on everybody in a second. Is there a better intended use for this product? Are we able to switch parts, or can we find the parts cheaper? That's an important thing. Is it a standard product? Can we be found easy? We don't want to buy something and we have to wait 6 months for it to be made again because they don't sell enough. Is it made on a proper tools? Can we consider quantity uses? What are we doing with it? How much are we going to use? If this is a one hit wonder for us that'll help us short term, or is it something we can add to our arsenal of tools? And then is it another vendor we can get it from at a less price? We got to we got to have our 3 quotes, and we got to make sure we have the proper vendors. So we do some of that looking at to make sure we've crossed everything before we try to get more support. Then we have, is anyone buying this for less? What is everybody else's prices? Those are kind of what we look at. Now, when I look at the team, and I spoke about the team a few minutes ago, it's really, we have environmental services floor techs, environmental services aides, we have trainers, we have customer service folks, we have our linen team, we have some supervisors in there from time to time, we have an infection control person, and we're sitting talking about how these things get better. Do we check the box off? And we don't get a chance to skip the process because we want this in fast. We go through the process. Those members are picked, and we're on a volunteer basis. We don't twist anybody's arm. Hey, we got a project. Do you want to work on it? Hey, we're doing this. We want to work on it? Hey, we've cleared this, and we're going to create a trial. Could we do it on your floor? And then we coordinate with the housekeeper and the manager of that floor, whether it be the nurse manager or the radiology supervisor, wherever we're going to trial a product at. And we kind of figured out once we getting through everything, we've incorporated our design team. So we make sure that what we are buying, works with all kind of materials or design items that we have in our hospital or on our campus. So we kind of look at all that. There's no term for any of the people volunteer. As long as you want to keep pulling, we keep asking, and so we keep it busy. My entire team knows we're on a journey to world class. So, if we're looking at robots, so we're looking at electrostatic machines, if we're looking at new disinfectants, if we're looking at new curtains, whatever it is, everybody has say in it that wants say in it. And then they get part of the job, but you got to go tell somebody about it. So, and it may seem basic, but when we get out and we get into the atmosphere and people are asking the housekeeper, wait, what about this? What do you think about this? They can answer the question from the heart because they know, and they've been part of the process and they believe it. So it makes a different patient and customer encounter. It improves morale. It helps actually keep compliance with our supply chain and our purchasing from our GPO. It does a lot of things that we don't count because I believe we did the right thing. At our most vulnerable time, we incorporated the people to help them be comfortable. We have taught them a new trade. We've empowered them, and we treat them like we should as being valuable team members. And I think it makes a difference. I think it really ignites people. And I can tell you it has great results. And the results are endless. You know, I can just reflect that, I've had team members where we've buried some husbands, we've buried some wives. And to look at them eyes, we owe them something different. And they've been at the hospital for long term. I think we owe them something different. I think if we go back and look at our team members differently and get them incorporated, it'll change your place too. Mike has talked a lot. Beverly's talked, and we've shared our story with you, but also going to take a chance to show you some results. So if we can indulge me for a couple more minutes. We've kind of made a little simple graph for ourselves that we follow and we look at, and it's basic. In 2020, in December of 2020, we were at 69% satisfaction with our courtesy and our patient experience. In December of 2021, we're at 83.4. 1 year difference. Change in practice. That's what the outcome was. And it was very simple. We take our team members and involve them in training. We involve them in our processes. We take and we begin to really truly think patients first, whether it's in season or out of season, whether it's budget stretches or budget crunches or good times. And we push it together with one common drive, which is to be world class. World class is a journey. We know it is. It's not a destination, it's a journey. So we continue to drive to get there. So I think Bill Gates said it the best. Only through focus can you do world-class things, no matter how capable you are. And it's very true. We focus on this. And we've really thrown the farm at it. And it really has produced dividends and taken us on a different trajectory. So, if it wasn't for our team, if it wasn't for our partners with infection control and our partners with supply chain, I don't think we could have got there. Each person doing their best and being an expert in those and putting it all together has helped us. It has guided us and it's catapulted us. Some people think we're crazy. We're doing a soap and sanitizer change in the middle of a pandemic. We're not crazy. We can be done and we can be satisfied with it, but we have things to do and we have a mission to go. So I just want to say we kept business going. We're getting back to normal, our new normal. But we wanted to just share our story with you and some ideas for you.
So it's 2022, and now we have our new normal. Not just did we incorporate new protocols into new cleaning protocols back in 2020, but now we have to incorporate those moving forward because now they've become part of the new infection control plan and EVS plan for the future. So going back to a few things Mike said, what the new normal is, and having EVS as a new partner in product selection, not just in a vacuum as they used to, right? Live in their own environment. Now we have EVS, but what that had taught us is really the value of the end user as a partner in selecting these products. We go through, is it a good fit for their organization? Is it what we need? But how is it going to be used? just like everything else in our house, right? If we buy something and we don't know how to use it or are unwilling to use it, it's just not good value at the end. So I think this pandemic has opened the door for innovation in how we select products, actually have innovation in doing some problem solving within our facilities ourselves. When it comes to, storage of this new equipment, where can we store it? Um, again, opening the door to a better quality products, green products. I think now we're in a journey where how can we improve the product selection process? And better than that, how can we standardize the practice of those green products, of those new products that that came up during the pandemic? All of those things is something to think about. And as we go through this journey and this newfound relationship between EVS and infection prevention, those are the things that we will be looking at. And also incorporating some quality monitors into that as well, because the goal, right, is not just that we adapt new products and we select new products, is that we decrease our HAIs in general, the same way we prevent the transmission of COVID, right, from the surfaces that we clean, but also, how can we roll and expand this new found relationship that we have? So what does the future hold for products in infection prevention and environmental services? Like Mike said, we have looking into robotics, right? AI is part of the new normal. New chemicals. I recall talking to a few EVS partners, and they share with me the new technology, new materials, the new microfiber mobs that they're using. When we switch, being an infection prevention as of close to 20 years, we use cloth mops, where that no longer exists, right? We have a different type of equipment that we use to clean the patient's room, and how easy it is for, us to really adapt to that new technology, being that it's being supported by infection prevention. We look at other ways that we can prevent the spread of infections in the hospital because of COVID, right? We have learned to use PPE a little better. We've become more accustomed to wearing PPE when before, it was not, you needed to have a different level set for that. Now they've become very comfortable, and I believe part of Mike's team is train the trainer. They become experts in training others to use PPE as well. So that was something also that opened during COVID, new opportunities for them to grow within their environmental services, being owners of their processes and their departments, and teaching others to become advocates for patients' safety by enabling them to empowering them to be the owners of their craft, I say. The other part that it's innovative in the heels of COVID-19 is staff adjustments, right? We've learned to do more with less in a way, but that's because we share in I call it the joy of the processes. So when we look at new equipment, we need to make sure that they're time savers for EVS and partners, that it does not take them a little longer to put their cart together, that they're able to put their carts and be out and about onto the floors, and they can cover more ground because we have given them products that may not require a lot of pre-mixing, a lot of prepping prior to them going onto the floor. And we can see them on the floor. So they're able to have the time with the patient, which has also become very important, right? The employee, the EVS workers tend to spend a lot of time in the rooms cleaning, and they get to talk to the patients. And that's how, that score goes up, because they're able to empathize. And at the same time, and make sure that the patients feel comfortable that the environment is clean and safe, and that they're in a good healing environment as well. So I think that really, even though we were shortened by staffing, we actually improved our customer service because we were able to get them out and about onto the floors a lot faster. Better chemicals, better products for them to be able, better tools for them to do their job. And I know every day we look at new products and new technology. And I always say you can see the cleanliness in the environment, right? Even though the clean is invisible, but you can see the cleanliness. You can see it in the how tidy everything is in the environment. So as an infection preventionist, those are the things that we look for when we go on the floors. And the first thing I always ask for is, who's your housekeeper? Who's your EVS partner? Because I consider them part of the clinical environment, right? They're in charge of the clinical environment where we are able to provide care for our patients. So giving them the ability to in the product selection, it's important. It's important for them to be able to speak to the ease of use of the equipment we give them, because that's the only way, right, that they're going to be able to use that equipment efficiently and be effective in their day. We try to make sure that they're able to touch everything that we trial, because that way they can give us an honest answer whether that's going to work or not. Also include and have that conversation with our clinical partners to ensure that there's no offensive odors, or it doesn't leave any films, just to get that feedback back from our clinical partners to ensure that the product is meeting the needs of that we intended it to be. So this has been a wonderful experience. It's been a great time to really really look for how can you say, be innovative is one way. I keep saying innovative because that's what we've been. 2020 we had some guidance, right, from the different organizations, but we had to make our own experience here. It's been one that of resilience. We've definitely pulled together when staffing still a shortage, when we try to ensure that our products sources were stable, or trying to stabilize them as much as possible, and being able to communicate. That opening those lines of communications is very important during any event, and the pandemic is still ongoing, but now we're incorporating those into a new normal. Just like we had other infectious diseases in the past, this one is here to stay. And again, how do we incorporate all of these protocols that we're under the COVID heading? Now they're going to be part of our everyday. So we've again included them into our infection control plan. And EVS definitely has a few pages on that plan when it comes to the cleaning protocols and how to best standardize them across the system. With that said, we look forward to improving our scores in 2022 because to be world class is to continuously challenge ourselves and understand that it takes all of us in order to reach the goal. And thank you for joining us today.
To earn your contact hour of nursing continuing education associated with this session, you will need to take and pass the 10-question true-false test with a grade of 90% or better. To get started, click on or copy and paste the URL into your internet browser to be taken to our CE portal. You will be asked to register, and then you will be directed to the test. If you pass, you will be able to view, download, and save your certificate. If you do not pass, you will have a total of 5 attempts to retake the test. You may store and share your grades and certificates for all sessions in the portal and access them by using the unique links provided at the end of each presentation. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. So here's a question for Mike. What would you say from an environmental services director's perspective? What did you bring to the table that really helped with this collaboration between infection prevention and environmental services?
Well, first of all, I would say it was started out of necessity. Our facility had been contracted out for over 30 years. As we went in-house, we noticed we had some things lacking. And we were on the doorstep of Joint Commission. So as Beverly and I got together, we understood the necessity and the urgency. So we agreed on some basic things. We're going to keep it simple. We're going to work together. And we're going to make sure it's done right. So I think over the course of probably about 90 days, we really started jumping into some things. And we had a lot of conversations, regular conversations, about what was broken, what needed to be fixed, how we can collaborate on different ideas and bring our years of experience together to make it a better place here. I would say just the first part of it was just an understanding of the business with both of us having so many years in healthcare. It made it a little bit simple. I would say one, ask for a seat at the table, but understand where you're headed and in the best interest of not only the facility, but your team members. I think that's number one. Number two is continue to be a student and learn because this is continually evolving. And it's okay to have a partner who pushes you and helps you get educated and educating yourself. So those would be the two things I would say.
While we're waiting for additional questions from attendees to come in, Beverly, why don't we ask you the same question? From an infection prevention standpoint, what compelled you to want to collaborate with environmental services?
So from an infection prevention, EVS are really the number one partner in ensuring that the environment our patients are in is safe for them. So to the previous question, understanding what resources they have, EVS, the department has, and how can we best apply those resources, especially in a rapid emergency situation like COVID was. What resources they have, and how can infection control support that? This is a mutual collaboration, and we really try to get the message as a unified message, and ensuring that it was simple and easy to implement. So we did a lot of brainstorming and how we can execute these plans that were adaptive, easy for not just the environmental services to adapt, but the bedside staff to adapt as well.
We have our first question from an attendee. This is for Beverly. What do you look for in an EVS director as a good partner for infection prevention efforts?
Great question. So one of the things I look at is understanding what methodologies they have used in the past, how open they are to technology, and what the resource they give to their staff. Understanding those elements will help decide on with which new technology to bring forth and how adaptable their staff is in being able to implement. And again, we're always here as a resource. Infection control is a resource. So they're the subject matter expert. We're just, trying to create that communication that is so they can have buy-in with the frontline staff.
We have another question for Beverly. Can you share with us maybe one or two things that you brought to the relationship from an infection prevention standpoint that we can learn from and address how to actually build a collaboration with environmental services?
So understanding really the parameters of the low-level disinfection and how the EVS really are the owners of that piece. And also understanding although the areas that are impacted by the EVS department, such as linen, right? That's another part of the environment of care that we need to have that partnership and ensuring, that the supply it's acceptable for a hospital, how it's stored within the hospital, how it's distributed within the hospital. So those are the few things that we look for.
We have a question for Mike. So how long did it take for you to build a relationship with Beverly and with infection prevention?
I want to say it was thrusted because of our situation of being in COVID. I think about 90 days to I think we had that relationship. We felt comfortable talking. It was continually growth from there. And we continued to learn each other. So I would say the journey really started at about 90 days. We could walk into sync and be able to have that good conversation, understood where we were both coming from. So we got down to the business at hand versus trying to do other things. We really started walking at that point.
This next question is for both of you. Can you explain what exactly constitutes quality parameters for low-level disinfection?
I would say we really look at how we're going to measure it. We can look at what we're doing, but how we're going to measure it to make sure it's validated or to make sure it's working, that we can either continue on that path or change. We need to change. So I look at technology a lot, whether it be black lighting or ATP or observations. So we really look at our program is really based on a few things. One, it's training. That's a big start of it, how we're trained. So we standardize training and we measure that as well. We look at, what the CDC says are the best practices. And then what new technology is out there. I think we have to grow with the times as well. So we look at what's quantitative. We report and standardize everything. And then we continue to monitor it. So we report to our infection control council those results on a regular basis. And we continue to push and we have a lot of dialogue. So it's a healthy conversation up and down to make sure we're hitting our numbers. And we post everything to our team. So everybody's in the loop. It's hardwired within our team.
Our next question is regarding the quality matrix you mentioned. ATP testing, is there a specific threshold that you're targeting?
Where our threshold as far as our quality measures, we lean towards the CDC recommendations of below 250. We do about 30% of our facility at this current time, and that's a combination of surgery and patient rooms. So we look at it, we monitor it on a regular basis. We've rolled it out to the system as well. So it's one of the big quality indicators for the system.
Here's a great question for both of you. How were you able to maintain evidence-based decision-making, science-driven decision-making when you were facing such incredible supply chain shortages?
I believe it's two ways. One, I have to be honest and say it was relationships. I think nowadays they're very much overlooked with this current technology world. But relationships, we continue with our vendors. They understand our mission. They understand where we're headed. And so they did everything they could to ensure that we got what we needed when we needed it, or we had a stockpile of it. That was one. And then two, we're basic. We're at basics. Don't do a lot. We want to keep it small but measurable. So we focus on what we do. All of our decisions and our efforts are based intentionally. That makes sense.
Here's another great question. During the pandemic, with limited PPE, cleaning was limited, EVS personnel were not let into rooms. How did that complicate matters, and how did you both address that in your healthcare system?
So we really looked at the data that was coming in. We look at the cleaners, the tools that we had, and then we really good all scientific observations in the sense of, did we see any transmission? Did we see that the environment, was responding to the cleaners, and for what period of time? So at the time, our protocols were, a little bit more consistent in the sense of how often we were cleaning the surfaces. So to ensure that, we were really impacting the organisms that were in the environment. And as a result, I think there were other positive outcomes. It's not just, that we were able to stop the spread of COVID from the environment type of piece, but I think we affected other organisms as well. So even though, it's almost a data that we're still evaluating, but I think there were other effects from the continuous cleaning of the environment, because we do, we have to understand that the environment does impact our patients' outcome.
Our next question is, with a limited supply of PPE, did that bring about unusual solutions, or perhaps solutions that had not presented themselves previously? And how did you leverage those?
I can take a stab at it. I think Beverly may have some additional things to add. I transitioned during the middle of COVID. And at the hospital I left from, we actually ran out of PPE and had the opportunity to erect a laundry in about 24 hours and actually began to work with partnerships with different vendors to actually provide reusable PPE. And so I think that was a great thing, but it also opened up a supply stream that we never thought about, and actually get a chance to incorporate it into our emergency management plan. EVS continued at both my facilities to continue to clean rooms. They wanted to be a part of the solution, but they also wanted to be safe. So I believe that's probably the best answer I can give.
From an infection control, we really work with trying to cohort and segregate those patients in those rooms. We actually identified a lead almost like a safety officer who ensured that anybody going into any of those rooms, whether it was EVS or nursing, they were appropriately fitted for their PPE, so their donning and doffing was appropriate. So we will, prevent any transmission and also self contamination for the employees. So they had that sense where somebody just checked me before I go in the room. From an EVS perspective, we gave them scrubs so they wouldn't have to wear the same uniforms throughout the facility. And again, we try to cohort the staff in those units, so we didn't have that constant cross-contamination throughout the facility.
Here's a great question for both of you. What are some lessons learned from the pandemic that you can apply to your next outbreak, the next pandemic, or even the next challenge that you face in your institution?
My lesson was really to go to your frontline staff and listen to them, because they may have the great ideas. They are the ones who are dealing with it, and a lot of the issues or the points that we implemented were born out of thinking outside the box by the frontline staff. So that was one of them. Not to be afraid to implement something new, as long as it's somewhat controlled and measured, so you can understand where it's coming from. And relationships, building those relationships within, EVS, nursing, infection control, to really get to, again, protect our patients, which is our number one goal.
I think it really took us back to patient-centered care and an importance of the relationships, like Beverly said. It takes the village to take care of our patients. So we've worked hard to really get back to that, where we want the staff on the floor to be a part of everything that's going on there. And we want nursing and infection control to be a part of what's going on in EVS. And so that collaborative relationship and that daily communication is there. I think that was a big lesson. And if our vision and as we push forward, will be to improve it, not just doing an emergency situation, but start to live it daily.
Our next question is from Mike, and it's a good one. So you mentioned that you pushed yourself to continue your education so that you can have not only a seat at the table, but to set the table. So where did you go to educate yourself as an environmental services director, just to help you stay ahead of all of the issues?
I think there's a couple places. AHE, we've adopted their guidance principles. We have adopted all of their training and certification programs and are implementing those. To also take advantage of those same classes that are out there. There's some interesting classes that are out there for not just our leaders, but for our team members. So we've tried to improve that relationship and make sure that's a big part of what we do. We also look at different vendors who have different certifications and programs and try to take the best of each company, so we're not tied to one thing or one thought process. We're really the best of the best is what we want to do and adopt. So we've taken a little bit of everything along with those guidance principles and made a program that works for our facility. Working with the Pierce Foundation, ESOP, really lending some help with technology, and really looking at things a different way and where we're going in the future. I think that's going to change what we do and how we do it. So I want to make sure we're doing it and support it any way I can.
Terrific. Beverly, let's ask you the same question. As an infection preventionist, where do you go to educate yourself, stay current, especially when it comes to emerging pathogens of concern?
So as part of the APIC organization, that's we have a lot of continuing education through them. It's a great organization. AHE, I empower every infection preventionist to really be part of AHE as well, because you can see, you can learn a lot about what the other departments that we affect, what they're getting educated on. So there's some sort of consistency in messaging. Again, vendors are a great source, especially continuing education as technology, and we try to move into a greener way of cleaning our environment. It's important for us to keep an understanding on how it's affected, especially with, trying to keep those emergent resistant organisms at bay.
Excellent. Thanks to you both. That's about all the time we have today. And a reminder, if you have additional questions, please send them to me at kelly@healthcarehygienemagazine.com. We will get them answered by our presenters and include them in a transcript of this Q&A that will be available for download shortly. We thank our presenters, we thank our attendees for your time today, and we'll see you at the next session.